Okay, thank you. So this decision has been delegated to Leeds Place from the West Yorkshire Integrated Care Board, and I'm aware that actually in the old CCG world we wouldn't probably bring this paper to the committee, but it is because it's been delegated from West Yorkshire. So I invite Gaynor to provide an overview and then we can have a discussion. Thank you.
Thanks, Chair. I'll be brief. The paper sets out the changes to the National GP contract requiring PCNs to take responsibility for delivering enhanced access services from the 1st of October. It brings together what are two currently separate elements to that extended access and extended hours. The paper also describes the process that we've gone through in gaining assurance that the plans for our 19 PCNs are compliant with the requirements of the contract. We've got a really good history of current service provision to build on. So the Leeds GP Confederation currently provide extended access services up to around 18,000 appointments a month, covering evenings and weekends, including Sundays, which actually isn't a requirement of the contract going forward. All but one of our PCNs have elected to subcontract to the GP Confederation to continue to provide half. So that for us in Leeds then results in a really good service continuity and no disruption causing issues to the wider health and care system. We've managed to secure additional non-recurrent funding to enable the continuation of the Sunday provision, as we felt that that was something that's been demonstrated in our system as being useful and needed, as well as non-recurrent funding for a separate contract for same-day response, again, which is delivered by the Leeds GP Confederation. And both of those two will be considered during the business planning round for 23 and 24. So the next steps are set out in the paper, as is the detail of the assurance, and the committee is asked to approve the enhanced access plans and note the fact that we've got minimal impact on our wider system due to that high level of continuity of our service. So I'll pause there, Chair, and I'm happy to take any questions.
Thank you very much, Gaynor. Would any members like to make points, ask questions, clarify? Dr. Beale?
I just want to pick up at the last point on paragraph 2.3, where it talks about patients being able to receive the right care from the right professionals and indeed at the right place. And I want to pick up the aspect for urgent care, because even sitting around this table, I guess there is not a uniformity of understanding of exactly where you go for what things. There are GPs, there's the A&E, there's the minor injuries unit, there's urgent treatment centre, there's walk-in centre. And it's very difficult, I think, for even as I say, people around this table, but certainly the people out there, if they've got what they perceive as an urgent need, and that may not be recognised as an urgent need in professional terms from our GP colleagues, but they perceive it as urgent, where from that list of options do you go to, and how do we communicate so that people have a better idea of where to go?
Yeah, thanks, Dr. Beale. I would agree, it's really confusing. The list at 2.3 is what's required in the national contract, so the language there around urgent and emergency care, I think isn't always that helpful. Within Leeds, we've established a same-day response programme board, and I'm the director responsible for that. And I think using the terminology same-day response, I think makes more sense when you talk about somebody that's got a need that needs the same day. I know if we talk to GPs
into general practice, and